Hey guys, it's Dr. Janice Stewart here with Holistic Sports Medicine, and I just wanted to jump on live real quick and talk to you guys about how to return to your activities in sports after having coronavirus infection. I just got back from the gym and was actually talking to somebody there about having the infection and trying to progress their activities back to how they were before having coronavirus. So I just thought I'd jump on and kind of share with you some guidelines that we follow in sports medicine that were put out by the American Medical Society of Sports Medicine in how to go through the stages of returning to activity. So we typically recommend this return to play protocol for people with more of a mild to moderate infection. So you didn't have to go to the hospital, or you weren't in the hospital for a long period of time, didn't have to have much more treatment than what you did at home, taking care of yourself, taking care of your symptoms. If you had more of a severe infection where you were hospitalized, or you had more treatments that required longer rest, then we do recommend that you get evaluated by a sports medicine doctor or see your primary care physician before returning to your activities. So even before starting this gradual return to play, you do need to rest for 10 days at the recommendation of the CDC or whatever your local guidelines are. And then you do need to be symptom-free and fever-free for 7 days, meaning no medication, no fever, cough, chills, muscle aches, body aches for 7 days before even starting the return to play protocol. So if this has happened, then you can start stage 1, which is typically your rest. You know, you're already isolated, you're resting, you're limiting your activities, no strenuous activities, just your activities of daily living. And the goal of stage 1 is to just recover. Once this is done and you're fever-free without medications, you can move on to stage 2. And stage 2 is light activity. So light walking, light jogging. The goal of stage 2 is to just increase your heart rate. Stationary biking is okay as well. So you just want to increase your heart rate, get your blood flowing, making sure that your symptoms don't return. We do like to limit the amount of time to 15 minutes or less, and keeping your heart rate at 70% or less maximum heart rate. If you do okay with stage 2, you can move on to stage 3. So we don't want any symptoms to recur during any of these stages. If they do, you move back to the stage that you don't have any symptoms, and then rest for a little bit, and then you can progress. So after stage 2, you have stage 3A. And with stage 3A, you are increasing your frequency of exercise. Your heart rate is kept at 80% or less. You are doing simple movements, jumping jacks, push-ups, body weight squats. You can exercise, again, for 30 minutes or less. And the goal of this is to increase your load. Hi, Mike. I'm sorry you have coronavirus, but please rest during your stage 1. Hopefully you aren't sick for too long. But anyway, after you get past stage 3A, you can move on to stage 3B, where you are increasing your duration. So now you can exercise for 45 minutes or less, again, keeping your heart rate less than 80%. And with this, you are doing more complex movements. So you can do high intensity interval training, box jumps, ladders, suicides. As I don't know, back in my day, we called them suicides. I don't know what they're called now for running up and down the court, touching the different goal lines. But anything that's going to test your coordination and your skills. So once you get past this level, you can move on to stage 4. In stage 4, you're just increasing your intensity of your exercise. You can exercise for 60 minutes or less, still keeping your heart rate at 80%, and you're pretty much doing your normal training activities. Again, this stage is going to restore your confidence, make sure your skills are back, and then you can move on to stage 5, where you have no restrictions. No restrictions on your heart rate, no restrictions on your intensity level or the activities that you do. And once you get past stage 5 without any symptoms, you can move on to stage 6, which is return to play. So basically, to recap, we follow a 6-stage return to play protocol. Stage 1 is resting. Stage 2 is light activity for less than 15 minutes, keeping your heart rate at less than 70%. Stage 3A is increasing the frequency with simple movements, push-ups, body weight squats, etc. Again, your heart rate's at less than 80%, and now you're working out for 30 minutes or less. Stage 3B, you're increasing your duration. You can work out for 45 minutes or less at 80% max heart rate. These are more complex movements like high intensity interval training, sprints, ladders, box jumps, things like that. Stage 4 is increasing the intensity, and now you're working out for an hour or less, again, keeping your heart rate at 80%. And this is to restore your confidence and to restore your skills to be able to move on to stage 5, where you have no restrictions. You're back to normal activity level, back to normal heart rate, no restrictions on that, no restrictions on time of how long you're working out. And then stage 6, where you're back to playing. So I hope this helps you guys. If you have any questions, please feel free to leave them in the comments. Yes, there are a lot of people having to deal with it, Mike. You're welcome, and please feel free to reach out to me as well. Leave any questions, comments in the chat. I will answer them. You can always follow me on Instagram and Facebook at Holistic Sports Medicine, Janice Stewart MD, or Holistic St. Louis on Twitter, and Janice Stewart MD Holistic Sports Medicine on LinkedIn. So I may do another live for more of the people that are in the moderate to severe category that need further testing. So keep an eye out for that. I still need to do my talk that I had to reschedule because I had coronavirus before Christmas about knee pain and how to protect your knees. So be on the lookout for that. And that's it. I will say bye for now. Until next time. Bye-bye.